Welcome back to the Rundown Lab, where we break down and fact check the biggest health podcasts. We know your time is valuable, but when you can, we always recommend catching the full episode. Links are in the description. What if the plastic particles found inside your body could predict your risk of heart attack or stroke? That's the provocative question at the heart of a recent discussion on cardiovascular health that's worth examining more closely. In this episode, Dr. William Davis explores the emerging research connecting microplastics and nanoplastics to heart disease. It's a topic that's gained significant scientific attention over the past few years, and the discussion covers everything from landmark studies to everyday exposure sources like tea bags and vegetables. Let's start with what this episode gets right, and there's quite a bit here that's well supported by current research. The central claim that plastic particles in your body may be a cardiovascular risk factor is grounded in legitimate science. The landmark Marfella study, published in the New England Journal of Medicine in 2024, did indeed find micro and nanoplastics in carotid artery plaques, and those findings were associated with worse cardiovascular outcomes. The episode accurately describes how patients with detectable plastics in their arterial plaques had significantly higher levels of inflammatory markers like interleukin-1 beta and tumor necrosis factor alpha. This inflammation connection is a key finding that researchers are actively investigating. The statistics presented about outcomes are also quite close to what the study found. Among patients who had plastics detected in their plaques, about 20% experienced heart attack, stroke, or death, compared to roughly 7.5% in those without detectable plastics. That's a meaningful difference that caught the attention of the cardiology community. The discussion of tea bags releasing billions of plastic particles is also well supported. A landmark McGill University study, published in Environmental Science and Technology, found that a single plastic tea bag at brewing temperature releases approximately 11.6 billion microplastic particles into your cup. That's not a typo. Billions, not millions. The episode also correctly notes that plant roots can absorb microplastics from soil, with root vegetables like carrots showing higher accumulation, and that cardiovascular disease remains the leading cause of death globally. Now, where things get more complicated involves some technical details that were either oversimplified or imprecise. The definition of nanoplastics given in the episode is off by a significant margin. The episode states that nanoplastics are particles less than 100 micrometers in diameter, but that's actually still within the microplastic range. Nanoplastics are properly defined as particles smaller than 1 micrometer, which is 100 times smaller than what was stated. This matters because particle size dramatically affects how these materials behave in the body and which tissues they can penetrate. The follow-up duration in the Marfella study was also slightly overstated. The episode mentions about 3.5 years, but the actual median follow-up was closer to 2.8 years, or about 34 months. The sample size was also slightly larger than described, at 304 patients rather than approximately 250, though this doesn't change the study's conclusions. There's also a small error when discussing how microbes break down plastics. The episode mentions they metabolize plastics down to carbon dioxide and oxygen. Actually, the products are carbon dioxide and water. Oxygen is consumed in the process rather than produced. It's a minor point, but worth clarifying for accuracy. The claim that about 70% of tea bags are made with plastic lacks clear sourcing. Many tea bags do contain some plastic, whether it's the heat seal layer in paper bags or the nylon mesh in pyramid bags, but that 70% figure isn't well documented, and the plastic content varies enormously between products and markets. There are two areas where the episode ventures into more problematic territory. First, the claim about intestinal cell gaps is significantly overstated. The episode suggests these gaps are normally about 1.5 micrometers wide, but healthy intestinal tight junctions actually have functional pore sizes measured in angstroms, roughly 0.4 to 0.8 nanometers. That's approximately 2,000 times smaller than claimed. While intestinal permeability can increase under certain conditions, this overstatement could mislead listeners about how easily particles enter the bloodstream. Second, as mentioned earlier, the nanoplastic definition error of 100 micrometers versus 1 micrometer isn't just a technical slip. It's a hundredfold difference that affects how we understand which particles can cross biological barriers and accumulate in different tissues. So what's the bottom line here? This is a largely solid discussion of an important emerging health topic. The core message that microplastics and nanoplastics are being found in human tissues and may have health implications is well supported by peer-reviewed research. The Marfella study is accurately represented in its main findings, and the practical advice about reducing plastic exposure is reasonable. However, the technical errors around particle sizes and some physiological details suggest listeners should cross-reference the mechanistic explanations with other sources. The association between plastics and cardiovascular outcomes is real and worth taking seriously. But we're still in the early stages of understanding whether this relationship is causal and what it means for individual health decisions. This is a field to watch closely as more research emerges.